Hey, this is Dr. Chris Heeb, chiropractic physician at Performance Health of St. Louis in Bridgeton, Missouri. Today I'm going to introduce you to a really cool topic, kinesiotaping. You might have seen this tape on various professional athletes like David Beckham, NFL running backs, NBA basketball players, college football players, or even Olympic athletes. Kinesiotaping is the #1 choice for rehabilitative taping within the international medical community. Why? Because it works. It is utilized in every level of athletic competition from pee-wee football to professional sports. This tape was developed in 1987 and is based on the body's own natural healing process. Kinesiotape activates your body's own neurological and circulatory systems. This method basically stems from the science of kinesiology, hence the name kinesio. Muscles are not only attributed to the movements of the body, but also control the circulation of venous and lymph flows and body temperature. Therefore, the failure of the muscles to function properly induces various kinds of symptoms like pain. In athletes, the normal wear and tear and sometimes acute injuries can affect optimum function. Kinesiotape products were engineered to accelerate the healing process and restore muscles and joints to their optimum functional capacity. In other words, kinesiotape gets an athlete back to the field faster with less time on the bench. This tape mimics the thickness, weight, and elasticity of human skin. It's water resistant and breathable and can be worn for up to 5 days after an application in a doctor's office. Kinesiotaping gives support and stability to your joints and muscles without affecting circulation and range of motion. It is also used for preventative maintenance, edema, and pain management. See, muscles constantly extend and contract within a normal range during athletic competition. However, when muscles overextend and overcontract, such as when lifting an excessive amount of weight, muscles cannot recover and become inflamed. When a muscle is inflamed, swollen, or stiff due to fatigue, the space between the skin and muscle is compressed, resulting in constriction to the flow of lymphatic fluid. This compression also applies pressure to the pain receptors beneath the skin, which in turn communicates discomfort signals to the brain, and the person experiences pain. This type of pain is known as myalgia or muscular pain. Consequently, so much attention was given to the importance of muscle function that the idea of treating the muscles in order to activate the body's own healing process came about. Using an elastic tape, it was discovered that muscles and other tissues could be helped by outside assistance. Employment of kinesiotaping creates a totally new approach to treating nerves, muscles, and organs. The demand for kinesiotape is unbelievable, and word has spread quickly to many athletes. Athletes in Japan, United States, Europe, South America, and other Asian countries. Kinesiotape has the ability to re-educate the neuromuscular system, reduce pain, enhance performance, prevent injury, and promote good circulation and healing. Many people ask, what is the difference between kinesiotape and your basic athletic tape? Well, conventional athletic tape is designed to restrict the movement of affected muscles and joints. For this purpose, several layers of tape must be rolled around and or over the afflicted area, applying significant pressure, resulting in the obstruction of the flow of bodily fluids. This is an undesirable side effect. This is also the reason athletic tape is generally applied immediately before the sports activity and removed immediately after the activity is finished. On the other hand, kinesiotaping is based on a different philosophy that aims to give free range of motion in order to allow the body's muscular system to heal itself biomechanically. Kinesiotape is used for anything from headaches to foot problems and everything in between. Examples include muscular facilitation or inhibition in pediatric patients, carpal tunnel syndrome, lower back strain or pain, subluxations, herniated disc, knee conditions, shoulder conditions, hamstring, groin injuries, rotator cuff injuries, whiplash, tennis elbow, plantar fasciitis, patellar tracking, pre- and post-surgical edema, ankle sprains, athletic preventative injury method. The list goes on and on and on. Kinesiotape works. It's that simple. In conclusion, kinesiotape is fundamentally different. Lance Armstrong once commented about kinesiotape in his book, Every Second Counts. He said, the tape could fix things. It could seriously fix things. In our office, we utilize SpiderTech, a line of pre-engineered, pre-cut kinesiotape-based therapeutic supports, developed to facilitate a functional medicine approach to pain control and myofascial dysfunction. Interested? Well, give our office a call at 291-5077. The cost is very reasonable, and some insurance companies actually cover a portion of the application. If you'd like more information, you can always go to my website at www.drheeb.me.